Hi, and welcome back. Today, I wanted to talk about my calcinosis and one drug that's actually worked for me in the past, and I thought maybe that I could share this with you, and hopefully maybe it might help someone handle the breakouts that they get. So with the calcinosis that I have, um, basically what calcinosis is, again, my body will not pass the calcium normally. So what it does is it stores up the calcium on the muscles and the tendons, which actually come out to be these lumps and bumps, basically all over your body. So in the evolution or life of calcinosis, some will just kind of form and just be hard lumps or bumps. Um, they'll kind of grow, stay there, stay the same, never get any worse. Some will keep on getting bigger and changing. One type that I found that is just absolutely terrible, terrible. It almost gets like infected like a boil. So what will happen is you'll get an area, from what I've been told, is the calcinosis is like laying down on your muscle. And sometimes I think what happens is your body is trying to protect that area. So it will push in a bunch of liquid, for a lack of a better word. And I don't know kind of what it is. In fact, one time I had this just massive, just huge one on my back. And what happens is it gets big and it's full of liquid and it's got to come out. It has to come out. So either it like comes to a head and just is like, "Bleh," and it's really gross when it comes out, or they just don't go away. I mean, it doesn't go away. It's a lot better if either I can take a needle and kind of pop it, for a lack of a better word, and open it up and let it drain. I went to the hospital once when I first didn't know what this was, and they go, "Oh my gosh, you have this really bad infection." So they stuck this needle in my back and they tried to withdraw it to do some tests on it, and it was so thick they couldn't even withdraw it into the needle. It was just crazy because he used this massive, gauge of a needle. So, in talking to my doctor and working with medications, we found out one thing that works, but I would say it kind of has a double-edged sword because it's an antibiotic. And so, antibiotics are known to basically kill every good thing in your gut. And basically, what I'm trying to do is I'm trying to reset my body, trying to get it healthy again. So, by taking this antibiotic, you kill all the good stuff in your gut. So you're kind of defeating that old catch-22 purpose of actually, taking the drug is almost worse side effects than not taking it. Anyways, with all that said, one drug that I have tried that has helped is called Keflex. And the generic name is Cephalexin, and it's 500 milligrams. Mine kind of look like this pill right here. Basically, it's an antibiotic, and they think that some compound, and they can't explain why. Again, this autoimmune stuff, they can't tell you why, but they think it's for this reason. They think there's a compound, or in the way the drug is structured, there's like a thing here and then a little rod and another thing, a chemical compound. It works against the calcinosis. So this is what happens when I see an area or I feel an area that I think is getting infected. So it gets red, it gets hot, it gets swollen. I'll immediately take the Keflex, and I can take, I think, my goodness, like up to 3 a day to try to stop it. So basically, if I feel it coming on, I'll take one, and then if I don't kind of feel that it's getting better, I'll take 2. And in the past, this has really helped these painful, just absolutely insane breakouts that are just, excuse me, just terrible pain. And they're just awful, and they're just not fun. They last about a week. So anyways, if you're dealing with these really bad breakouts with your calcinosis, again, talk to your doctor about Keflex. And again, with this autoimmune, it might work, it might not, but we need to get together and we need to try to figure out what the best, drugs and things are that we can do together. So anyways, if you enjoy my videos, if you could just subscribe, I would really appreciate it. And please comment down below. Tell me what you're dealing with. Let's all try to get together as a group and just tell me some things that maybe have worked for you, and maybe together we can kind of make our lives a little bit easier. So anyways, have a great day and I'll see you next time. Thanks. Bye.